Hello friends, this is Dr. Nikita Deshmukh again. Today I am here to discuss about different causes of hearing loss which can be corrected with the help of surgery. So now we have to understand one thing. Ear has three parts: the outer ear, the middle ear and the inner ear. The middle ear which is present, it has three bones: malleus, incus and stapes. So it's basically a conductive mechanism. What happens is air travels in the form of sound waves and the eardrum vibrates. After the eardrum vibrates from the external ear, those vibrations are going to be transmitted through the three bones: the malleus, the incus and the stapes. Malleus is like a hammer. Then you have the incus, and stapes is also called as a stirrup. So it is basically having a shape in such a way that it fits into a structure. It's something like this. And then you have the inner ear. So if there is a condition in which either the malleus, incus or stapes are fixed, or because of some kind of injury there has been a discontinuity in the ossicles, this we commonly see after diving, after scuba diving and things like that, or after injury in the form of any kind of trauma. Apart from that, there is a congenital condition called as otosclerosis. Now this is seen more in women and it aggravates in pregnancy also because of some hormonal disturbances. Now this particular condition is where the stapes is sitting in the foot plate. Now it gets fixed, it becomes rigid. So because of that, the sound waves will not be conducted properly, because this is like a fixed structure. It's supposed to vibrate. Now it's not vibrating. So in this particular condition, which is called as otosclerosis, the eardrum will be intact. There will be no discharge at all. What will the patient have? There will be decreased hearing. There will be sometimes some ringing sounds if the sensorineural component has come, and that's it. So it's very difficult and it can often be missed, especially if it's on one side. Since you are able to hear from the other ear, you will not notice it. So many times as a part of screening checkups, we come to know about this condition. So there is an entity called as airborne gap. So if it's a conductive hearing loss and the airborne gap is good, then these are good surgical candidates. If the airborne gap is narrow, that is if it's a mixed hearing loss, then it's better to go for a hearing aid. So both the options are there. You have a hearing aid option also, you have a surgical option also. So proper selection of cases is extremely important. Now how do you do the surgery? There are two techniques. There is a technique which is a technique in which we remove the stapes first, or there is a technique in which we make the hole in the stapes foot plate first, and then we remove the suprastructure and then put a new piston. So it's basically like just you have knee replacement for the knee joint, that way you have bone replacement for the hearing bone, in simple terms. But this surgery is not as gross as the knee or the hip. This is a very delicate surgery because ear is the most precious organ. Okay, so the flip side of the surgery is that if the piston, the stapes piston, which is a foreign body that we put in the ear, some patients might develop a reaction to the piston because it's a foreign body basically. So after some time, even if the on-table hearing is good, after some time they can get a delayed hearing loss. In the sense, the hearing capacity will slowly start wearing off. So this is definitely a risk factor. There are different types of pistons. You have normal Teflon pistons, there are gold pistons, people even used to use platinum pistons. So that way the price goes on increasing. But what is important is basic surgery. The surgery has to be done extremely carefully, and it is ideal to do it under local anesthesia with sedation so that you can check the on-table hearing. And when there are different methods to drill the foot plate also. Foot plate means the place where the stapes is sitting. You can either use burrs or you can use perforators. Perforators are like, there's this kind of movement and then you make the hole basically in the foot plate, and in serial perforators are used. So these are the technical aspects. But what is most important is after doing the surgery, you have to have an absolute rest period. You cannot go on bikes, you can't go on flights and things like that. You don't have to lift heavy weights, you do not have to strain too much, you don't have to cough too much. The idea is that whatever stapes piston we have put, it should not get displaced. So that is most important. As important is the surgery, as delicate is the surgery, equally important is the post-operative care, which is the responsibility of the patient and the patient's relatives. So if you are ready to be so careful, then only there is a point in doing the surgery, because that is one surgery which will give you result. One of the surgeries in ENT which gives you instant result, as good as a cataract surgery. After cataract surgery you can see, isn't it? So that way after stapes surgery you can hear. That kind of dramatic effects are there. But if things go wrong, they can go wrong also. Like if there is a rejection and whatever hearing is there, that also will go. So that's called as a dead ear. So that is the flip side. Although it's very rare, but the possibility is there. So you have to explain it to your patient that yes, this particular thing also can happen. Whatever hearing you have might just go away, and that can happen anytime, no? Because this is a foreign body, not immediate post-op. After 3 months, after 6 months also we see patients getting delayed complications. So it is our responsibility as doctors to tell the patients about every possibility, and safer options also are there, no? Like hearing aid is also there. So let the patient decide whether they want a hearing aid or they want a surgery. If they want a surgery, are they ready to take that risk of sensory neural hearing loss, which can happen anytime? So very important is educating the patient. So this is a very risky surgery, but other surgeries of the ear are not that risky. Like if we have to do osteoplasty, we have to put a new implant, you can use the same bone and reshape it and put it, or an artificial torque pop. There are many things, but most avoiding surgery, most rewarding surgery, as well as the most risky surgery is the stapes surgery. So this is what I just wanted to convey. And for conductive hearing loss, we have surgical options. Either we graft the eardrum and change the ossicles, or we can correct the hearing. Conductive hearing loss, you can definitely give a good hearing here. That should be our basic intention. So, and if it's a mastoid is something in which it is a dangerous condition. It's like some termite, it's destroying the bone and can go into the brain, it can go into the mastoid bone. So these things are also there. So in those cases, we have to give the patient a safe ear first, and then we can stage it later and give them a hearing ear. I mean, these are all intraoperative decisions. See, sometimes there's something called as the facial nerve. If it is dehiscent, then we can't put anything on top of that. So we have to allow it to heal. So basically, if you ask me, in here there is nothing tailor-made. It is more about going inside and then deciding, and these are all on-table decisions. So it's very important that educate the patient and understand what the patient wants. Whether they want hearing ear or they are more for cosmetic thing, it depends upon profession of the patient also. So I think it's important. It's not like straightforward. It's a little challenging, I can say. Thank you.